Hey, Dave O'Sullivan here, and today what I want to talk about is the CRM method for getting your patients to have more buy-in, compliance, and ultimately getting results. Okay, so the CRM method, that's an abbreviation for C is for context. Okay, so that's the first thing you need to have is every rehab exercise that you are prescribing, you need to show the context of why you're prescribing that. Okay, now that's a good audit for you as well. Okay, because what a lot of therapists do is we go through the motions and we give the same old exercises to the same patients. Okay, because naturally we as therapists, we're human beings, we take the path of least resistance. Okay, so you need to audit yourself and go, okay, where's the context that I'm prescribing this rehab exercise for? Okay, so that's the C. In terms of the context, how is this going to help the patient? As I say, 6 hours versus 6 reps, okay, or 8 hours versus 8 reps. How is this rehab exercise going to help the patient? And there's opportunities to practice this in the 8 hours throughout the day. Okay, so C is context. If your patients aren't buying in or doing your exercises, then you need to work harder in the context of how you're delivering your rehab exercises. Because whether you like it or not, you have to sell your rehab exercises to your patient. When I go and work with professional athletes, I have to sell these rehab exercises to the patients. Okay, now there's two other things in the CRM method. Okay, that's also important, and the R is results. Okay, the rehab exercise needs to deliver a result. Okay, the quickest and easiest way to get your patients to do their rehab exercises is if they feel better after they do the exercise. Now, there's going to be a fundamental shift that needs to happen here when you prescribe your exercise. And that's where you're going to have to go away from the strengthening focus, which we know takes a little bit of time, okay? And we need to more focus on the coordinative aspect of the rehab exercise. Okay, so with majority of my rehab exercises, the first thing we do before we worry about the strength is we worry about getting everything doing its job. Okay, so when you focus more on the coordinative aspect of a rehab exercise, you get everything doing its job. Okay, naturally, then when the patient goes for a walk after a set of the exercises, they usually say something like, "Oh, I feel a lot springier," or "I feel a lot lighter." Okay, or "that feels a little bit different." So they need to be able to feel a difference and see the results. Okay, whereas if you're just focusing on strengthening exercises, okay, and there's not a change or a processing change at some point, okay, then very often the patient, they'll do it for the first couple of days, but then naturally, human beings, the motivation level is going to drop again. Okay, so that's a subtle shift of focusing more on coordinative rehab exercises as opposed to just strengthening. Strengthening absolutely has its place, okay, but the first thing we need to do is actually show the nervous system that it's safe to actually tolerate load before we put them into strengthening situations. Okay, so that's the R. So context, results, and then the M is milestones. Okay, so your treatment plan in the first session, you should have nailed out a set of milestones that the patient is going to achieve. Okay, what do they need to do? What do they want to do? Then your rehab exercise needs to fit into those milestones. So that then loops back to the context of the patient understands where this fits in the overall picture and how by doing this exercise they're getting one step closer to the dream outcome. Because remember, the patient comes to you initially to achieve a dream outcome, okay, which is the top level of the graded exposure. The thing that's going to keep them coming back to you ethically is that they can see that they're hitting these milestones and they're on the right path in order to achieve this dream outcome. So this rehab exercise needs to link to the next milestone that the patient is going to achieve. And if you can do that, you will not have any problem getting patients to buy into your exercises, getting patients to do your exercises, and then ultimately get results. So if they're not buying in or they're not doing your exercises, it's probably going to come down to one of those things. You're not explaining the context enough. The results aren't there quick enough for the patient. Okay, there's not a processing change happening soon enough. Okay, whether we like it or not, unfortunately, we need these things to get results quickly, especially in professional sport. And then the last thing is the milestone. Okay, how does this fit into the overall plan? If you want help with this, if you want help mapping all of this out, more than happy to help you. I've got a couple of free trainings. Just press in the comments below, yes, please, and I'll send you a message and I'll get the most relevant training to you depending on your situation. Okay, so that's it for today. Once again, if you want more information about this, if you want help gaining the confidence and clarity to build a step-by-step system to get results for patients, keep patients on track without dropping off, and ultimately grow your clinic the right way, then don't be afraid to send me a message either. I'm more than happy to help any way I can. All right, so till next time, speak to you soon. If you want that free training, just pop a